Yeah, so there's a compound in cannabis oil that is highly effective in treating anxiety, and I just, went through that a little bit before. It's known as CBD or cannabidiol. It actually is probably one of the best medicines I've ever come across for anxiety, and I've used a whole bunch. I mean, in my 12 years of practice, I've used quite a lot of different medications for this, and I find CBD has probably got the best risk to reward ratio. Or type of profile when it comes to the medications. What I mean by that is the risk is extremely low from a side effect potential. There is actually no level of CBD that you can take that will get you to a lethal dose. Okay, so you could literally drink a gallon of CBD oil and probably not have too many detrimental effects from it. And it's very, very hard to say with any other medication out there on the market. Aside from the fact that, obviously a gallon of oil will probably upset your stomach a little bit, like there isn't really other dramatic side effects. I've seen patients sometimes have a little bit of mild sedation from it, but my suspicion is these people had a reduction in their anxiety, and it reduces their sort of stress hormone levels like adrenaline, cortisol levels enough that they feel a little bit more calmer, and often they feel a little bit more tired because of that, rather than the CBD itself causing that. We know CBD is non-psychoactive as well, or more accurately, non-euphoric. It doesn't actually cause people to get high as well. It's known to be a cognitive enhancer, in fact, in that people, when they take CBD, they feel a lot sharper. They feel their stress and anxiety reduce, and it can often help with their insomnia that's related to the anxiety as well. Additionally to that, it's also a good analgesic. So I would say it's probably a moderately good analgesic, meaning it's a good pain reliever and an extremely powerful anti-inflammatory. So it's got multiple therapeutic benefits to this medication. To the second part of the question, is it approved by the TGA? The short answer is yes. You can get TGA approval, but it has to be patient-centered. So we have to apply for TGA approval for every patient that uses this medication on an individual basis. It's not like your antibiotics or Nexium or whatever or cholesterol medications that sort of a doctor can just write a script for anybody and it's approved. The doctor has to get approval from the TGA, which is the Therapeutic Goods Administration, to allow you to use it. And the TGA will look at your history that's been submitted by your doctor and make a decision as to whether you're a good candidate to try it. So every person needs an approval to use it by the TGA or approved prescribers across Australia that can write you a script for CBD or medicinal cannabis, in fact, if they've done enough training behind them. In terms of the approval process by the TGA, there has been recently a Senate inquiry talking about contemplating whether CBD should be an over-the-counter medication. And I think, in due course, this is probably going to happen. We're going to see CBD be deregulated in such a way that it might be a lot easier for doctors to prescribe, or in the next year, 2, 3 years maybe, you might even find CBD behind the counter at a pharmacy, and the pharmacy could dispense it for you. Because in actual fact, when we come to prescribing this stuff, like I almost see zero side effects from this. It's one of the best medications I've ever seen. We've probably written maybe 700 scripts or so in our clinic for medicinal cannabis, and I've only ever had to stop someone on CBD oil once because it increased her chronic pain a little bit, and she got no benefit from it. I've never actually had to stop someone because they got dramatic side effects from the medication. All in all, I think CBD is fantastic.